Good morning. I'm Joan Klagsburn, and I'm delighted to be here to talk with you today about ways you can listen to your patients with greater empathy and greater compassion. Not only does listening alleviate their suffering and build their trust, but having the kind of connection with your patients where you hear their stories and you get to know them and you learn what matters most to them, your work can become more satisfying and more effective. Maya Angelou reminds us of something we all intuitively know but too often forget. She says, "I've learned that people will forget what you said, will forget what you did, but people will never forget how you made them feel." And how the patient feels can have a profound effect on the course of their treatment. What we're really talking about here is a comprehensive model for effective cancer care, which is composed of two elements. Of course, it's composed of effective diagnosis and treatment of the disease, but also a positive relationship between clinician and patient. And one of the best ways I know of creating a positive healing relationship is to listen to your patients with genuine interest and empathy. We all know that cancer is commonly experienced as a loss of control, a loss of predictability, events that feel like being cast upon a darkened, stormy sea. And in my many years of working with people with cancer, what people most say right afterwards is, "I'm overwhelmed, I'm blindsided." And so as patients are catapulted into this new realm where they have to make difficult medical decisions, it's crucial to have some trustworthy guides. When facing a cancer diagnosis, it's important that you have clinicians who will help you to set your compass and navigate this new world, all the while providing some comfort and some encouragement. And one way I have found to accompany patients is through listening to them with empathy. So what do I mean by empathic listening? Well, empathic listening comes from the word empathy, which comes from the Greek, which means to suffer with. When someone acknowledges your suffering, it automatically reduces your stress and your sense of being alone with it. Now, it used to be thought that empathy was an inborn trait. You were either born with it or you weren't. But now we know that it is a skill set that can be learned and improves with practice. Empathy is simply imagining what it's like to be your patient. And empathic listening encompasses a couple of things. Number one, it involves perceiving what the patient might be experiencing. And so by looking at their face, hearing their tone of voice, looking at their body language, you can actually discern how distressed they are, if they're anxious, if they're confused, if they're reticent to speak to you and share with you what's going on. But you also can respond verbally and non-verbally to the patient. And you can do this by including your attentive facial expression, your good eye contact, your warm tone of voice, your body language, your posture. It all matters. Sometimes the nonverbal behaviors that you are least aware of affect your clients the most, your patients the most. And another way to have this sort of empathic connection is by having bi-directional communication. Bi-directional communication. And by that, I mean you want to hear from your patients and have them share information. You're obviously imparting a lot of information to them, but you also want to make sure that you're hearing from them as well. It's only through a shared knowledge with the patient and shared understanding that you can come up with a care plan that makes the most sense and that's co-created with them. But unfortunately, as you all sitting here well know, there are many barriers and obstacles that can make it more difficult for a clinician to treat their patient in this way. So let's look at some of those. What are some barriers to this form of patient-centered communication? Well, the first one is managing those electronic health records, which you're shaking your heads. Yes, they're frustrating, they're time-consuming. Another is the time management pressures you're under, the clock management that most of you are under to not be able to spend as much time with patients as you might want to. And then there's all kinds of unreasonable expectations you might be having from your institution. And interestingly, there's one study that found that if patients are left to speak uninterrupted and to share their complaints, on average it takes them 92 seconds, a minute and a half. But the average time it takes before they're interrupted by their physician is 22 seconds, right? Another study I read said 11 seconds. So it may actually be more time efficient for you to let the patient say what they want to share with you. Another barrier you have is vicarious trauma. And many of you experience this. You are witnessing your patient's physical and psychic pain. You're experiencing their grief when treatment doesn't go well, and sometimes you're experiencing their dying. This distress can cause you to feel overwhelmed, and so that might decrease your capacity to really listen fully to patients. So I recommend that you make sure you metabolize these situations. You write in a journal, or you share with your colleagues or with loved ones. Don't keep it inside, because that will really lead to more burnout and compassion fatigue. And then for some of you, I think there's really insufficient training in medical school to how to build relationship-centered communication with your patients. In medical school, some of you were taught to maintain clinical distance, not to get too close to patients, and to present always with an even temperament. But patients need an authentic human being to relate to. I want to tell you about Daniel Horn. Daniel Horn is a physician who had a serious bike accident leading to brain trauma. And so for a couple of years, he became a patient before he went back into practice. He said before his accident, he was able to meet all the targets for quality, volume, and revenue set by his institution. And he became a leader in his organization and believed that he was a happy, fulfilled doctor. But after, he said, my accident taught me that most of the work I was doing isn't what really matters to patients. Now, he said, I listen to patients more attentively, talking through their concerns and their goals. I make sure they know how to reach me if something's going wrong. I call them and their family members to discuss important issues. I offer hugs and high fives. The magic, he says, is in the listening, the talking, the access, and the advocacy. What Daniel Horn discovered is that what really matters to patients and the people you treat is the connection they have with you. So despite these numerous barriers, which we know can lead to burnout and to high rates of burnout and compassion fatigue, we now know that there are ways to implement this kind of patient-centered communication, which will increase your patient satisfaction and also, I think, enhance your own well-being. So let's take a look at what are some ways to increase empathic listening. Well, the first is to make sure before you enter the room with the patient to check in with yourself, to make sure you arrive fully present in your meeting with the patient and that you're not carrying or still processing a former situation with another patient. And so one strategy to do that is to have for yourself a brief self-care ritual that can help shift your physiology and your mental state. So what could that be? Well, one way is to actually do some slow-paced breathing technique. So what I do between patients is I inhale to the count of 4 through my nose, and then I hold it for a count of 4, and then I exhale to the count of 8. And I do that 3 times. And I find that that gives me kind of a buffer zone between one patient and the next. So that's something to try. Another might be to close your eyes and do 30 seconds of meditation, right? Whatever it takes. Maybe for you, it's look at pictures of your children on your phone before you enter the room. Something that will clear your mind and allow you to freshly be there, open to hearing this patient and not still carrying baggage from earlier situation. The second suggestion I have is for you to begin every meeting by consciously setting a tone, conveying a warm, accepting attitude, showing the patient that you're actually glad to see them. That can make a huge difference. Your emotional state affects everyone else in the room. Obviously, when you enter the room, you're going to kind of listen for and pick up the temperature in the room. But you actually set the thermostat. When you enter the room, you can lower the temperature for everyone. You can bring it to neutral. Well, how do you do that? Well, one way, as I've said, is by making good eye contact, turning away from your computer, and really connecting on a human-to-human level with your patient. Another thing you can do is to empower the patient, to give the patient agency by having them be included in setting the agenda for your meeting. So you might say something like, of course, I have some agenda items I want to discuss with you today, but I'd like you to take a moment and just see if you have 2 or 3 concerns that you want to make sure we cover today. Not only will this give the patient permission to ask their concerns, share their concerns, or ask their questions, but if they happen to have a sheet of paper that you can see that has 15 items on it, you're saying that will help them to realize you're probably not going to get to cover everything in this one meeting. Plus, this will help avoid those very awkward moments where you stand to leave. I call them doorknob moments. You have your hand on the doorknob, and then the patient asks you their most urgent question or shares a most serious concern, right? That's always distressing. So this will help that. Including the patient in the agenda setting demonstrates that this is a shared enterprise. You're interested in their input. You're working together. After they speak, you want to acknowledge and summarize the essence of what they said and reflect back to them. And don't be afraid to use their exact words. It's always very validating and affirming to hear back our own words. The important thing is that they feel you have heard and seen them. And then another way to implement this patient-centered approach is by occasionally having some authentic, genuine curiosity about the patient's life. I can offer some personal examples here because, unfortunately, my husband was diagnosed with cancer about a year ago. And early on, at the end of a meeting with a clinician about symptoms and protocol, she said to us, "I'm curious, what do you guys do in your other life?" It was very validating for us, for her to recognize that we actually had another life, and took us only about a minute to answer her, but we left feeling we had made a human connection with her. And I was also touched that she didn't only ask the patient, my husband, what he did in his other life, but she also asked me, and that made me feel included, that I was a valued member of the team. My husband switched oncologists from someone who felt like a competent body technician, he happened to be a male, to a female who's extraordinarily competent, but also is warm, authentic, and personable. She insists we call her by her first name, and when she learned that my husband writes poetry, she said, "Oh, good, you're going to educate me. I know nothing about poetry. Please bring me one of your poems next visit." Her humanity has made all the difference. And of course, it's a real bonus if you can manage to get on the patient's wavelength. My husband is quite playful, and he jokes and uses humor when he's anxious. And a few months ago, he was about to have an injection in his abdomen that would take 3 to 5 minutes to complete. And so before he got the injection, he said to the nurse, "Will I get a balloon when you're finished?" And she smiled and said, "I'm sorry, I don't have a balloon today. Maybe next time." And then he said, shot back. He said, well, if you don't have a balloon, how about a song? And she, as she's holding up her gloved hand with the injection in it, she said, I think I do have a song. And then she belted out, this is gonna hurt. This is gonna really, really hurt, but you'll be fine. And they both burst out laughing. The injection went without a hitch. Obviously, this playful moment cheered up my husband from his long day at the hospital. But I think it also was positive for the nurse, who clearly had a playful side herself. When real contact happens between patient and provider, it benefits both. So I said it's important that you provide support to your patient. You could say things like, I hear you're going through a hard time right now. I want to help you get through this, or let's check in together about this issue next time. I have a patient who has breast cancer, and she adores her oncologist. And she said, you know, not only does she ask about my treatment, but occasionally she'll ask, how's my tendency for depression going? How's my therapy going? That makes me feel like she sees me as a whole person, not just a breast cancer patient. And it's very important to have a positive closing moment, not to end abruptly, but to really say, maybe, is there anything I've missed? This is just for 30 seconds. I'm not talking about extending the meeting. But we're going to work together to manage this treatment. I'm going to keep an eye on this issue, right? And a patient of mine who has ovarian cancer says that she always feels uplifted at the end of every meeting with her oncologist. And I said, well, what does the oncologist do? And she said, well, like last time, I said to her that I was really bothered by this cough that I had. And she reframed it for me. She said, every time you cough, remember that that means your chemo is working. You're having side effects, but it means your chemo is working. She said, I feel so differently now about coughing. It has a whole different meaning to me. Helen Reese, some of you might know her. She's a psychiatrist in Boston and the author of the wonderful book, The Empathy Effect, has spent the last 20 years training physicians and nurses in increasing their ability to communicate with patients with empathy and with compassion. And she uses a patient care inventory. She asked patients, at the last meeting, how was your doctor at really listening and letting you tell your story, showing care and compassion, fully understanding your concerns, being interested in you as a whole person, making a plan of action with you, right? She has gleaned what really helps patients. And there are actual benefits of listening to your patients with more empathy. They feel acknowledged, they feel understood, they feel cared for when you really listen to the whole person behind the illness. By contrast, there are studies that show that in peer-reviewed journals that show that treatment devoid of empathy leads to dissatisfied patients who are less likely to follow treatment recommendations that you give, more likely to lose trust in you, and more likely to have poorer health outcomes. And happily, there are many studies that have found that empathic listening skills do build trust. They do allow for better collaborative decision-making. They reduce patients' anxiety. They also lead to more retention of physicians, to less medical errors. They benefit both the patient and the physician or the nurse. Listening is such an important tool in your toolbox. So I hope you can hear that the key takeaway is the quality of the relationship you have with your patient is a crucial element in their treatment. A positive relationship amplifies the effectiveness of their treatment. And of course, we want to offer that kind of connection to patients who differ from us through race, through age, through sexual identity, and through political views. And please know that being a supportive presence is important no matter what the outcome of the disease. At times, if things don't go as planned for, you might simply be holding space for your patient's grief so they're not all alone with it. And by listening to your patients with interest and empathy at every stage of their journey with cancer, you are alleviating their suffering and their isolation, and hopefully also making your work more meaningful. I'd like to give the last word to Sir William Osler, the father of modern medicine, who wisely told us, "The good physician treats the disease. The great physician treats the patient with the disease." Empathic listening is a cornerstone of effective, comprehensive patient care at diagnosis, as a healing agent, and as a way to foster and strengthen patients' relationships with you. Thank you. So I think we have a little time for questions.
Do we have any questions?
Can I just add one thing? Thank you so much for a really great lecture. So one of the things that I found is that it truly is important to sit and listen to your patients. The other thing that I have discovered, which unfortunately is lacking in contemporary medical care, is the power of touch.
Yes.
And so it's disappointing to me the number of patients who I come into contact with and they say, a physician or a provider has never even touched me. And so the listening and the touching, I think, go almost hand in hand.
I'm so glad you mentioned that, because I think just a pat on the shoulder, a hand on the back occasionally can be enormously helpful. So that's one of the nonverbal behaviors you want to really be sure to include. Thank you.